This morning on BRN, working has a positive effect on mental and physical health in older adults. Joining me now to discuss this is Jeff Kullgren of VA Healthcare System. He's also an associate professor at the University of Michigan. Dr. Kullgren, great to see you. Thanks for joining us on the program this morning.
Thank you for having me.
It's great to talk to you, and I think this is an amazing study. Let me start by asking you just a basic question. Based on your analysis and the survey work that you and the team have done, how important is work to our overall physical health, but also our mental health?
Yeah, it's a good question because there are a lot of possible benefits to people working as they age. And we know from this survey that we conducted as part of the University of Michigan National Poll on Healthy Aging, where we surveyed over 2,000 Americans age 50 and older about whether they work, and if so, what benefits they find from working. We find that working at age 50 and beyond certainly has obvious financial benefits. That's the main reason why people work. But we were somewhat surprised and glad to learn that many people as they age find a lot of other benefits from working. Those could include benefits like social connections, a sense of purpose. So it's important for us to recognize that working beyond age 50 has not just the obvious financial benefits, but a lot of other potential physical and mental health related benefits as well.
So does this break the paradigm? I'm going to call it the retirement paradigm, for lack of a better. I'm not a PhD by any stretch of the imagination, but does this kind of shift the paradigm away from I'm going to retire at age 65, I'm going to sit on the porch with my grandkids, maybe play a little bit of golf? Maybe does it kind of break that a little bit and actually say, hey, it's important to still contribute to society in some way?
Yeah, I think it does speak to the fact that the relationship between one's age and their work is really an individual issue. Obviously, especially as so many people continue to face economic and financial challenges. Some people don't feel like they have much of a choice to work beyond age 65. But we found in our survey that there are people who choose to work beyond age 65. And again, that can be because it's helpful for them to have some extra cash around. That really is the main reason that people reported to us that they continue to work at age 50 and beyond. But I think that there are a number of other people looking for other benefits from working. I see this, I'm also a primary care physician. And so I certainly have heard this before from the patients that I care for, that for some of them, especially who face issues around loneliness, who may not have maybe live alone and don't have much in the way of social connections, one of the main times in which they connect with other people is when they go to their workplace. And that's where they have those social connections and those relationships. And so I think there's a lot of other positive benefits. We could say the same thing likely about, even though we didn't focus in this poll on that age group, about younger people too. Certainly many of us, if we think about our own lives, we think about relationships we have in the workplace. I think that's natural. But I think as people age and they face, in particular, issues of loneliness, this is really a unique opportunity to think about, okay, how can I work not just for the money, but also for the friendships and the connections?
Yeah, I completely agree. And I work remotely, and I wonder. You mentioned the social interaction within your survey. Did you get a feel for people that, for example, worked 100% remote, worked 100% in person, or were hybrid workers, so they did a little bit of both?
Yeah, we did ask. It's a great question because certainly the workplace has changed a lot in the
Yeah.
last 5 years, right? Before COVID, during and beyond. And we did find that among those who work at age 50 and beyond, it really is a minority of those who exclusively telework. So it was about 15% of people said they work fully remotely or they telecommute. There's a decent proportion of people who have kind of a hybrid role. But really, it's the largest group of people that work fully on site or in person. And so it's a really good question. I think that's an important issue that as we're thinking about that social connectivity that can come from the workplace for older adults, that we're hearing about those benefits from a population of people who largely are working in person.
Yeah, I mean, I look, I work remotely, as I said. I like to know that people actually have bodies from the sternum
Yeah,
down.
right.
I mean, that's
Real
certainly
people in three dimensions.
real. Yeah, they're real human beings. Doctor, what about changing vocation? So, say you were an attorney, and or you were a doctor, a clinician like
Yeah,
yourself.
yeah.
What about shifting your vocation, maybe doing something else, or maybe is it as fulfilling to do that, or maybe is it more fulfilling, for example, to embrace a teacher mentor type of role, where you can share those experiences with a younger person.
Yeah, yeah. It's a good question, and in any survey, there are always some trade-offs related to how deep we can go into any one particular set of issues, and our ability to collect the data. So, for example, the longer we make the survey, the less likely it might be for people to stay with
Sure.
us, right, to collect the
Yep.
data.
Yep.
And so we're not always able to go into every particular issue that we might want to. And I do think that in any good survey, it raises more questions than it answers because to your question, as we think about having a sense of purpose and the benefits people derive from working, does that always need to be what the bulk of your career was in? My personal opinion is that it does not always need to be that. In fact, again, if I think about the patients I care for, many of them had one other sort of job, whether it be as an attorney, whether it be running a small business, working a trade, something of that nature. They work in a totally different role later in life. It is a bit of a reset, I think it can be when you end your main career and then you move on to something else. And maybe there, you were you went to school for something, you were trained in something. It, Many people, I think, often kind of continue on down that path as you end that phase of your career, though, and enter a new chapter, whether it be retirement, whether it be that next phase in life, it's an opportunity to think about what you want to get from being able to work, and also, an issue we haven't talked about yet, maybe we will in a moment, is the many health issues that people face related to work, and then kind of where that fits in. Because there are many people, unfortunately, that are not able to work to the extent that they would want to because of health challenges they face. And so as people
Yeah.
think about, what could I contribute? What am I, what issues might I have that get in the way of contributing in the way I might want to? It's a new chapter and a new opportunity to think about what that could look like. And so I don't think it always needs to be what one is trained in or what the bulk of your career has been focused on.
Let's talk about that issue that you brought up, your health, and over time you're going to face all sorts of maladies at all ages, but maybe
Yeah.
more so as we age. How does that impact the person directly, but also the employer potentially hiring or employing somebody a little bit older in stature with a more mature worker with more experience? Put it
Yeah,
that way.
indeed, indeed, indeed. And so, it's a really important issue and an important question because, some people may be hearing this and say, well, that's all fine and good, but I can't work because of some of my health challenges. And I think that, if folks are thinking that, you're not alone in that experience. So we did ask about barriers that get in the way of people being able to work to the extent that they might want to. And we found, in fact, that about 2 in 5 US adults age 50 and older reported some sort of barrier that got in the way of them being able to work to the extent that they might want to. And when we asked about what some of those barriers were, the most common one was a disability, a chronic illness, or poor health. And that was in nearly a third of people had issues like that, health related issues that got in the way of them being able to work to the extent that they may want to. Another health related challenge that we asked about is, we asked if people are able at their job, if they're able to take time away from work to attend healthcare appointments. People who face a number of chronic conditions, for example, and have a lot of appointments to get to, that could be a full-time job in and of itself. And
Mhm.
so if you're going to work at a job, obviously that's an issue that one needs to think about. We did find that people that reported being in fair or poor health were more likely to say they had trouble being able to take time away from work for medical appointments. So even when people, challenges to people working to the extent they might want to, even when they have a job, some of those health related issues can make it difficult to get the care they need. And so that's where I think that both, employers and clinicians really need to be thinking about the work opportunities and constraints related to health that can face older Americans and how they can help be part of the solution to make sure those who want to work are healthy enough to be able to do so and experience some of those health benefits that can come from working.
Last question for you, Doctor. Are there some lessons from the survey for policymakers, both at the local, state, and federal level when it comes to our more mature members of our society in terms of what you've discovered in terms of the survey? Are there lessons about how to change or shift society to maybe embrace some of these older workers and bring them to the fore as part of the workforce, or bring them back as part of the workforce, or continue to leverage them as part of the workforce?
I do think there are some important messages for policymakers here. So, when one of them gets back to a question you asked earlier, which was about, does this kind of change the narrative around you hit age 65, you retire, and then you move on to a different phase of life that doesn't involve work. And I do think that this kind of dispels that notion. Certainly, that's the case for many people, but not for everyone. When we think about work, naturally, the first thing that comes to mind are the financial benefits from that. I do think it's critically important for policymakers to realize that that many older people who work, they do so for a number of other reasons. Okay, that yeah, of course, all of us would agree that having the money is nice and important. But yet there are things beyond that. So, for example, people reported that being able to work helps them maintain social connections, keeps their brain sharp, is something we commonly heard from older Americans in our survey. And I mentioned having a sense of purpose. And so I think it's really important for policymakers to recognize the health-related benefits that older adults reported from being able to work, and recognize it's not just about the money, but there are other reasons why older adults might want to work. At the same time, recognizing that many older adults who want to be working more are not able to because of health-related issues. And so it's important for our healthcare system to try to help older adults be as healthy as they're able to be, given the health issues that they do have, so that they can participate in the workforce to the extent that they want to realize some of those health benefits, especially as people age. And this is the final point I'll leave you with. People age 65 and older who worked were more likely to report some of those health benefits from working than those age 50 to 64. So in particular, people beyond age 65 reported a lot of those other health-related benefits from working. And so we do need to dispel that notion that, there's a time for working and there's a time for not. Really, there are many older Americans who are making very critically important contributions to the workforce. And the people who work with them, that wisdom that we talked about, that experience that we talked about, and realizing a lot of health and social benefits from doing so. And we need to figure out how we can provide that opportunity to as many older Americans as possible.
Well said, Doctor. Thank you so much for conducting the survey, and thanks for joining us. And we look forward to having you back on the program again very soon.
Thank you so much.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, at our website. And your subscription helps support all this great BRN content. And we're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.